morning. I hope you're all ready with your questions for today's Apollo 24/7's Health Hour. We are not just going to talk about cancer management and its treatment, but we are also going to talk about managing COVID for cancer patients. Joining us shortly at 11 a.m. is Dr. C.S. Mani, a senior oncologist from Apollo Specialty Cancer Hospitals, Chennai. You can join in the live session and ask all your questions about cancer and COVID. Can cancer patients take vaccination safely? What are the other safety protocols one has to follow if you're dealing with COVID-19 and cancer? Join us in the live session. See you there, 11 a.m.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar and welcome to Apollo 24/7's Health Hour. Today's session, we are going to talk about cancer treatments and management amidst the COVID-19 pandemic. Every week, Apollo 24/7 brings you an expert from Apollo hospitals to talk to you directly, to answer your questions and queries and clear a lot of misinterpreted fear amongst us. So this week, we are going to have Dr. Mani CS, who's a senior consultant surgical oncologist from Apollo Cancer Center, Chennai. He'll join us very shortly. Before that, let's talk about a wonderful initiative which is called Sanjeevani, which is an initiative, which is a CSR initiative by Federal Bank Hermes Memorial Foundation in partnership with Network 18. And the health expert on this, the vaccine partner, is Apollo 24/7, where together all these have come together to create awareness around vaccination. They're creating drives, they're facilitating, they're initiating good conversations. So it is important to get your vaccination done. Sonu Sood, the brand ambassador, the Good Samaritan, has got the shot through this Sanjeevani program, and he has something to say. Let's listen to him.
Our campaign ambassador Sonu Sood was able to get a hassle-free jab done, all thanks to our health expert on the campaign, Apollo 24/7. Earlier, he used the Apollo 24/7 app to register himself in what is a very easy and quick process.
Hi everyone, so all set. So today is a vaccine day. आज मैं पहली दफ़ा जाकर I'm taking the shot, and I'm pretty excited, and I just want everyone to follow this. Today I'm in very safe hands of the nurses, doctors and staff of Apollo 24/7. So all set, let's follow. So all done. पता भी नहीं चलेगा आपको, लेकिन आपकी सेहत को ज़रूर पता चलेगा कि आप एकदम सुरक्षित हो. So just go have your vaccine today. So the vaccine is done. एक बहुत ही इम्पॉर्टेंट चीज़ आपको याद रखना है कि वैक्सीन लेने के बाद 30 मिनट्स तक डॉक्टर्स के पास रहना है. आई थिंक छोटी सी जिम्मेदारी आपके देश के लिए. थैंक यू.
सोनू सूद ने वैक्सीन लगाया, आपने लगाया क्या? So Apollo 24/7, the health partner for this wonderful program, has facilitated vaccination for the entire nation. As the largest group of hospitals, Apollo Hospitals is now ready with the job of getting vaccinations for the country. You can get vaccinated in India's most trusted hospital chain, Apollo Group. And what do you have to do to get 18 plus? Now we are all ready. We are waiting for our turn. You have to register yourself at www.cowin.gov.in. And then once you register, please book your slot at the nearest Apollo hospital, because booking a slot is mandatory to get vaccinated. They cannot take in direct walk-ins till further notice. So you better book a slot and wait for your turn, get vaccinated with Apollo hospitals. All right, let's start today's discussion. Today is a very, very important topic that we are taking up. We are talking about cancer treatment and management with our expert oncologist, Dr. Mani CS, who's a senior consultant surgical oncologist at Apollo Cancer Centers, Chennai, who has more than 20 years of experience in general surgical and breast oncology, who's trained in robotic surgery at University of Alabama, who guides research on stem cells in cancer, genes involved in aggressive cancers and pre-cancers. Is associated with various researchers on immunity against cancer. He was awarded the Shigekara Award by Japan, by AFLA, that is Asian Federation of Laryngectomes Association. He's established the first national cancer tissue bank in collaboration with IIT Madras, and is the founder of the non-profit organization CRRT, the Cancer Research and Relief Trust. It's a pleasure and honor of welcoming Dr. Mani CS on the show. Namaskar, welcome to the show, Doctor. Doctor, your audio is on mute. If you can please unmute yourself. Yes. Good morning, Doctor. Welcome to the show.
Good morning. Thank you very much for having me on this show. I'm honored.
It's our honor to have you here on a Sunday morning. I understand the immense pressure that you must be all in. Thank you so much for obliging and being here for the wonderful show. Thanks, Dr. Mani Garu. And as I understand, it's 31st May is the World No Tobacco Day. Let's talk about tobacco and cancer first. You must be seeing a lot of cancers, but I understand that smoking is the #1 cause of cancer and the lung cancer too. Can we talk about this, doctor, and why smoking is detrimental for health and how it promotes cancer?
So it is almost now about 56 years since we identified world across that tobacco is the biggest sin and it is the biggest chemical of mass destruction. So that report came in 1964 from the US General Surgeon. And then thereafter, there has been several reports reinforcing more and more evidence rained against a vast number of diseases, starting from cancer, which occurs in about almost 20 organs, not just lung as people may tend to believe, but it can happen in 20 different organs because of smoking. And another group of diseases, including the cardiovascular, the respiratory disease, even your reproductive health. People tend to get infertility because of smoking. So there is a huge damage that is caused by the tobacco, and it is concerning, so much so that, way before the vaccine race happened for COVID, we also were thinking whether if we should also innovate a kind of vaccine for smokers itself to bring them out of that addiction. So there are n number of things that is happening in terms of controlling smoking and cessation of smoking, both at the clinical level, at the society level, as well as at the research level. Therefore, I think this is an opportunity to stop this here. Quit now, please.
Exactly, and that's an important call. Quit now. It's the World Tobacco Day tomorrow. Doctor, as you were mentioning before, it's not just the cancer, but smoking can cause a lot of other issues. Right now, in the pandemic, COVID-19 is associated with the lungs, and smoking actually can increase our risk. Is that correct, doctor? And what is the risk of smoking and COVID-19?
Absolutely right. And, at this point in time, we should also kind of reinforce that misinformation that was initially propagated, saying that smokers are in some ways protected against COVID. It is not so. The lung is the primary site of attack for the SARS-CoV or the COVID illness. And if you're a smoker, you're at a very high chance of transiting yourself into a severe illness and risking a high percentage of fatality. So smoking and COVID cannot go together, and quitting smoking now is the best point and best decision that you can take.
Yes. So as you're talking about quitting smoking, I have a few friends who would say, what's the point? Ab tak to kuch nahi hua. I haven't met with any serious consequences till now. Why should I quit now? What is the answer?
Well, when my grandfather says in his 95th year that whether he has to quit smoking, I would say, yes, you have to quit smoking even when you're 95 years and you have gone scot-free, because the dose relationship between smoking and the disease that you may get is not fixed for any one individual, or there is no average across the spectrum. So even one puff of smoke is sufficient to cause the damage. And if you have lived 95 years, you're just lucky. Until that point, 96th year may be your year of whatever disease. So you be aware, you be cautioned that you've been lucky until now, and now is the time to quit.
Okay. So as I understand that one puff is also equally dangerous. How about passive smokers, doctor? How about
Absolutely.
Who are inhaling smoke? What are they at risk?
They are at a very high risk. This has been showed more and more recently. The 2020 report also reconfirms that. See, if you initial things, interestingly, the original study about smoking came from doctors. The epidemiologist Richard Doll in UK actually found out that all the smoking doctors died 10 years younger than their non-smoking colleagues. And then he worked on their spouses. And the spouses also died 10 years younger than the non-smoking doctor's spouses. So this has been extrapolated across the community, across international societies, all over the place. And we have shown that there is an added mortality risk of about 10 years if you are a smoker. So there is a tremendous risk in terms of smoking, and quitting at any point is the best solution to it.
Okay, doctor, thank you so much. And quickly to cancer and COVID. People have been asking questions, and pre-registered questions have already reached us. I'm going to ask you a few questions from the chat box. So the first question, and a lot of people are asking this question. I can't take the names because there are too many questions of the same nature. So I will try and club the questions. People, whenever you're typing a question on the chat box, may I request you to complete the question in one go so that it's easy for me to look at the question. People are typing it in bits and pieces, which is getting a little difficult for me to gather information. And please don't mind if I've not taken your name because there are too many questions. So the first question, doctor, that a lot of people are asking, are vaccines safe for a cancer patient?
Absolutely safe. All types of vaccines are absolutely safe, and any cancer patient can take the vaccine immediately. There is no need to hesitate. There is no need to go and ask your doctor once again whether it is safe for you. It is absolutely safe for all cancer patients. There are ongoing treatment related issues. So for those people, you must get a consultation with your doctor.
So people who are ongoing with cancer treatment, they have to wait. But somebody who's recovered from cancer and somebody who's finished their treatment, they can absolutely go ahead and get their shot done. Right, doctor?
Yeah, every one of them. And it's very vitally important. And they all need not fear that the fact that they had cancer earlier predisposes them to COVID in any severe way. There's no need to fear about that. And it is quite safe to go and reach out to the center where they give this jab. You're not going to contract infection there, and you must take your step forward and get your jabs as quickly as possible.
So while doctor reiterates the importance of vaccination, a lot of people who have asked this question in similar kind of questions, I think that's the answer. But if there are any other questions related to it, I'll take in the course of the program. But right now, I'm asking Srikant's question, who has taken the second dose of Covishield in April and has commenced chemotherapy 1 month later. That is May, she has started her chemo. Will the vaccine protection be compromised or reduced due to the ongoing chemotherapy?
Absolutely not. See, the fact that you've taken vaccine is the best thing you could have done. After you take the vaccine and a month later when you take the chemotherapy, there is no influence of the vaccine over the chemotherapy or the chemotherapy over the vaccine's protection. Both are independent. The vaccine acts on a different set of cells and chemicals within your system, and your chemotherapy acts on entirely different set of cells and chemicals in your body. So therefore, there is not much of overlap or interaction, and so therefore you are safe to have your chemotherapy well after the vaccination, and especially 1 month is quite a good time to have your chemotherapy and continue on your cancer treatment.
Right. Mr. Ganeshan, Inbasegar Ganeshan is asking this question. My wife is undergoing chemotherapy and she is just finished a third cycle of chemo. Is this good for a COVID vaccine now?
Absolutely. So we tend to make use of this interval between two chemotherapies. If there are 3 weeks in between your chemotherapy, after the second week is completed, and before you go for your next cycle, you go and have your jab. Give that gap of 5 to 6 days between the jab and your next chemotherapy. You're absolutely fine and safe. So there is no need to delay just because of the fear that you're undergoing chemotherapy, and in some ways is going to cause enormous immunosuppression and bring down the effectivity of the vaccine. Or some people even imagine that the vaccine itself may be infective, which is the biggest myth that can be fought against. So their vaccine does not give rise to disease. Vaccines are safely given, and the reaction that you may have for a day or a couple of hours later are nothing to do with the disease per se.
Okay, that's a really important myth that you've busted. Vaccine is not going to give you the disease. Right. Next question, doctor, is NVJ Ramya. Father was diagnosed with CML in December, and at that point he was admitted for COVID treatment. He had recovered from COVID and has started on imitinab 400 from March. Is this the right time to have vaccination?
if he had the infection 3 months before, I'm sure this is the right time to have the vaccination. So if it is 1 year,
Okay.
definitely it is imminent.
Done. Srinivasan Elumalai, his mother had a breast removal surgery 10 years back, and she's completely recovered and not under any medication at this point. Is she good for a vaccination?
Absolutely. She is a cancer survivor. She is a conqueror, and she must be the ambassador to go forward and do this vaccination and help people understand that COVID is as good or as bad as cancer that she has already conquered. So go out there and get your jab and be your ambassador to vaccination, please.
I love the positivity that you are using, doctor. That's the way to go ahead, and that's the call. Get yourself vaccinated. All right. So, Harmesh Khanna, इनका भी vaccination question है. My husband is under treatment for lung cancer since June 2020 and had COVID in October 2020. Had a good amount of antibodies when tested in April 21. 8th chemo is on 12th May. When can she get the vaccination done?
All right. So there is a subtle distinction between getting immunity from the natural infection, that is COVID, versus getting immunity through the vaccine. So anybody who is already infected should mandatorily get their vaccination 3 months later, because that immunity is not sufficient for you to cover for a lifetime, or at least for as long as we know, a year or more. The immunity you get by vaccination is about 10-fold better, powerful, stronger than the immunity you get from natural infection. And it is quite ironical that in certain kind of diseases, the immunity from the natural infection is far less than from the vaccination. And this is a classical example we can tell, the COVID virus. So please do get vaccinated, even if you had the infection a few months before.
All right. So I think that's a call of different segments of vaccination are covered in the first 5 questions itself. Somebody who has to take vaccination before, after. And here's the next question. Dr. Shivani is asking, mother had recovered from salivary gland and lymph node carcinoma 4 years ago. Is it okay for her to take the vaccine, COVID vaccine right now? And is she okay to take the other vaccines also? Not just the COVID vaccine. I think it's important for cancer patients to get other vaccines done.
Yes. So you're eligible for all types of vaccination. And in the age group where you get salivary gland cancer for mother, you're talking about the flu vaccines, which are the normal vaccines taken annually. So that can be done along with the current COVID vaccination. So there is no problem in taking this or any other type of vaccination as is required by your health community.
Done. Mr. Sean David, who's a regular viewer, and he's asking this question, which I think is important for today's topic. He was a smoker of 40 years and quit 4 years ago. He's 63 now. Am I standing at a risk of cancer?
First of all, congratulations, sir, for taking that step to quit and maintaining that cessation status for the last 4 years, because you have proven that you can quit and don't have to relapse once again. That is the most crucial thing that you have demonstrated. For your question about whether you're at risk for cancer. Now, when you stop smoking, each year there is a reduction in the risk of cancer. And you tend to become the risk of the normal non-smoking population at around 10 or 15 years after quitting the smoking. So therefore, the next, you're 63 now, so I would suggest that until you're 78, you continue to be on an annual health checkup and be very open for consultation at the situs of any symptoms whatsoever, because you have taken a very pro-health decision. And the pro-health decision should be followed up by getting yourself checked up preemptively, proactively, preventively, so that we don't get into something which is of a type that we'll have to face a lot of flack about. So please go ahead, get your preventive checkup until you're 75, 78, please.
Yeah, wonderful. And with that call, quit smoking, everyone. All right, next question is Shivani's question. Mother has dysentery and watery stools regularly and too much of swelling in legs. Please give me some advice what to do. Is this a kind of a sign or a symptom that one has to look out for cancers, doctor?
All right. So there are a million reasons to have dysentery, diarrhea, and swelling of your feet. So I wouldn't want to do risk assessment on the show here, but it is vital for you to consult some expert who would be dealing with this. Now, there is no need to fear because it could be as simple as some kind of an infective diarrhea that is self-limiting and it will pass off. Or if it is anything else, it is the right time to go check it out and fix it immediately rather than delaying on these things.
Okay, thank you, doctor. Lalita's question here, what should be the total count of antibodies after the vaccination for patients undergoing chemotherapy? Patient's chemo cycle is 21 days. And is it important to check on the antibodies, doctor? First point.
At this point in time, checking on the antibodies is only of academic interest. We do it for epidemiological research in order to see what is known as a seroprevalence in a community. But to check your individual antibody levels is not that important. But what you should understand is, as soon as you get your vaccination or if you had your infection, there are two types of immune response that you're going to be having. One is called the humoral, that is the antibody type of response. And the other thing is called the cellular response. And within the antibody type of response, there are going to be two types of antibodies. One which is going to act immediately within the next couple of days, and the other which is going to act over a lot of time, months to years even. So that is called the IgG antibody. So we are not going to be worried about testing this. Now, beyond this, the cellular immunity is where your T cells and B cells tend to embed inside them a kind of a memory against the SARS-CoV virus. And that is going to swing into action anytime there is even a sniff or a whiff of a SARS-CoV that may be appearing in the vicinity of your system, and therefore you are safely protected. So you don't have to have a certificate showing that my antibody level is so much and therefore I am so protected, and there is no need to discriminate one against the other, showing the values as if it is a mark sheet in an examination.
Let's not get into that fight now. Let's get the vaccination done and leave the rest for. All right. So Sai is asking question. Mother is a breast cancer survivor. She's COVID positive at this moment. She's not taking any COVID medication. She's just isolating. Should we proceed further? When should she take the vaccine? I think it is the complication of not taking medicine.
Well, see, there has been a lot of changes, we're trying to keep evolving the treatments for COVID in the last year or more. So the changes are so rapid that it's even difficult for physicians to cope up with. So therefore, I can understand your dilemma and confusion, but we have to understand there is no direct drug which is going to act on the COVID SARS-CoV virus. There is no such specific drug. So denying somebody of that, there's no such drug, so therefore there's no denying somebody of such a drug.
Yeah, exactly.
But what we do know is we need to confirm that we are dealing with the SARS-CoV, that is with the RT-PCR swab test. And after that, we have to triage them. In which stage are we? Are we in the stage of mild disease? Are we in the stage of moderate disease? Are we in the stage of severe disease? Your cancer may add a little risk, but not that far, especially if it is a treated cancer, it's not going to add to a whole lot of risk. So if you think there are other comorbids besides the cancer, be it hypertension, be it cardiac disease, be it respiratory disease illnesses, so all this, if it compounds and there is certain other elements to believe that you may move from mild to moderate or moderate to severe, then it's a question of trying to get some medication or medical help. But if it is not so, then staying at home in a quarantine and isolated manner would be sufficient, so long as we can monitor the problem inside.
Okay, that's interesting. Thank you so much for throwing light there. Next, moving on, I'm going to ask you questions about the types of vaccines and the timing for cancer patients between the dosages. Megha Pandey is asking, my mom is undergoing chemotherapy for stage 2 breast cancer. She's already taken 1 dose of COVID vaccine. Should she take the second dose too?
Yeah, of course, she has to take the second dose too. And now the government regulation requires about 80 to 90 days of interval between the first and the second dose. So whenever her cycle of chemotherapy falls on the 90th day, she could take a week before that second dose of vaccination. And she must take the second dose, absolutely.
Vikrant Chaudhary is 39-year-old colon third stage chemo is done. Platelet is still low. Should I go for vaccine? If yes, then which one should I prefer, Covishield or Covaxin? And this question, doctor, is repeated multiple times. Covishield or Covaxin or Sputnik?
Yeah. All right. So we need to know the difference between these three vaccines. The Covaxin is nothing but you take the virus and then boil it to a certain temperature so that the inner genetic material is removed completely, destroyed completely, and you only use the outer shell of its virus, its body, and then use that as a vaccine. So it is all the proteins that is comprising that virus minus the genetic material would be the vaccine that you're getting if you're taking Covaxin. Now, if you are taking the vaccine Covishield, you're actually taking a bit of a genetic material which is injected into a carrier virus. It is called an adenovirus. And some people even make fun that it's some kind of a monkey virus. But you take that as a load, there's a payload. So the virus would carry this SARS-CoV genetic material into our system and activate our immunity. Sputnik is some such thing. It is prepared by an institute called the Gemella Institute, and they have similar kind of a vector virus. We call this all as vector viruses. So in terms of efficiency, in terms of toxicity, both almost compare the same. So it does not matter which is the name of the vaccine, so long as whatever vaccine is available in your vicinity. Timing is what is most important. Go there out immediately and get whatever vaccine that is available. All of these vaccines have been well established to be safe.
All right. So it is safe. And yes, the other question that Vikrant was asking is platelets still low after the chemo. Is it a good time to take vaccination?
Well, we need to consult with your oncologist to make sure that he's going to give you some kind of a booster to correct all these parameters. And it is best to optimize all these levels before you go for your vaccination. That is true.
Important, and you can consult your oncologist, or there are oncologists on the Apollo 247 platform can be consulted. Right. Next question is Sai Shivani's pre-registered question. A mother is having cancer. She has allergy for NSAIDs and quinolones. Can she take the vaccination with the allergies?
Yes. So the allergy component is an issue only for a small component of the vaccine. It is called an adjuvant, or you can say in colloquially some kind of preservative that we use for the vaccine. Except if you have specific allergy to that sort of preservative, there is no worries about having any other allergy. People talk about dust allergy, people talk about so many other types of chemical allergies, which need not come in the way of getting your jab. So the type of allergies we are talking about is minuscule, which is 0.001% in the population. By far, all the other people who have allergy are free to go and have this vaccine. It is safe and nothing would happen to you as complication.
Arpita's question, Arpita Kundu. I am a papillary thyroid cancer patient. Operation and radiotherapy have been done. When should I get the vaccine, and when should I get it done? After surgery?
At the earliest. See, if you are a papillary cancer thyroid patient, they would have done an operation, and after a month's time, they would advise you for a radioactive iodine treatment, if it be the case. So if you could complete both these treatments and then go for your jab, it is fine. So
I think the same answer for Sharmila as well, undergone ovary cancer surgery 1 month ago. I think that's the time for her to go ahead. 1 month.
Right.
Yeah. All right. So wonderful. Because one question, doctor, answers a lot of people's queries. So keep asking your questions. While I cannot take the names, I've been writing down the different cancers that people have been marking. Pancreas, partial nephrectomy, lymph carcinoma, breast, tumor in the bladder, endometrial cancer, rheumatoid arthritis. Can we take the vaccine?
All right. So let's take rheumatoid arthritis out of this bandwagon because all the others are cancers. Rheumatoid arthritis, one may know, is inflammatory condition of your joints, and it is due to what we call as auto antibodies. So the immune system in our body works against our own tissue in some small way at certain small regions in the body, and therefore gives rise to a set of diseases called autoimmune diseases, of which rheumatoid arthritis may be one such. And in these type of patients, we tend to give a treatment which will suppress the immunity. So in these type of patients, whether we should give vaccine or not, yes, we should give the vaccine after moderating the dosage of the specific medicine which is causing the immunosuppression. So there is absolutely no problem in you continuing with your regular treatment and then going for the vaccine. In terms of all the other questions, pancreatic cancer, partial nephrectomy, bladder cancer, whatnot, regardless of the type of cancer, you are ready, and the answer is immediate vaccination.
Okay, done. Lalita's question is, basal cell carcinoma is recurring even after surgery and arising out of new spots. Can it not be treated at all?
It can be treated. The basal cell carcinoma is a very, very, what should I say, not so fatal a cancer. First of all, it doesn't kill anybody, and it's a skin cancer. It is easily detectable and it is easily treatable, except in certain very complicated anatomical locations where it could be troublesome. All the other basal cell cancers are easily treatable. But if you are getting recurrent basal cell cancers all over your body, there is some fundamental genetic defect perhaps, and there are certain types of medicines currently available. Thanks to the Human Cancer Atlas, we have got enough number of targets that can specifically focus and target this genetic defect that gives rise to multiple basal cell cancers. Therefore, it is time that you go and talk to your oncologist about the genetic basis and the systemic treatment that is available right now.
Okay. Doctor, I missed the name of the person who's asked this question, but yeah, who's a cancer survivor, going through chemotherapy, and they have COVID right now. What is the person at risk? What's the risk of the person who's going through cancer and COVID-19?
Right. So we had this problem quite a few times in the last 1 year and more. So we would diagnose and get them prepared for treatment, and they would test positive and not be able to complete the treatment. So in so far as they are concerned, they're not in any way immunocompromised sufficiently to require admission and treatment. Of course, if the cancer patient had several other comorbid illnesses alongside, like diabetes and hypertension and things like that, they could develop a serious illness. And there we give priority to treatment of the COVID first, get it cleared and out of the way. In the process, we have modified the cancer treatment in a tremendous number of ways in the last 1 year. There are many kind of changed treatment protocols wherein we try and reduce the immunosuppression involved in the cancer and facilitate their concurrent treatment as well. There are other alternative methods of treatment. Instead of surgery, we would give them hormonal tablets. Instead of chemotherapy, we would give them targeted treatment. So in most ways, we are able to manage both COVID and cancer, which can happen simultaneously, which has happened in quite a substantial number of patients in the past 1 year. And therefore, there is no need to be afraid. The COVID doctor and the cancer doctor will together plan your treatment in such a way both are taken care of.
Wonderful, doctor. Great. So next question is Sudha Ganeshan. She's undergoing chemotherapy for recurrence. WBC is 2,600. Can I take vaccine?
Absolutely fine. Yeah, you can take vaccine. WBC 2,500 is not a problem.
All right. Yeah, there was an important, yes. Cancer patient who is lactating, can she take the vaccine?
Well, there is new guidelines coming into the fore about people who are pregnant and lactating. And there is evidence now to show that it's safe for them to take the vaccine. Yes.
Yes. Shweta was asking this. somebody who's going through cancer and going through various kind of treatments, how can they be safe from COVID? And are there any specific precautions to be taken for cancer patients?
So we call this as a social vaccine. And what is social vaccine? You mask yourself up, double mask, you keep a safe distance, and you keep your hygiene well. So this social vaccine can be instituted right away. There is no problem for you. When the turn comes for you to safely get vaccinated by the routine method, you go for your regular vaccination. So to keep yourself safe, it is like anyone else. You have to maintain that distance, keep your nose and mouth nicely masked with a double mask preferably, and then go down with your treatment.
Okay. Then Mr. Swaminathan Manyam is asking, I've undergone surgery for colon 8 years back, and prostate gland seems to be developing to malignancy. PSA is 7.9. Got 1 dose of vaccination. Should I go for the second dose of vaccination too?
Absolutely fine. Yeah, you should go for the second dose of vaccine, and prostate cancer should not come in the way. And there are 7.8 PSA is not that high a value. You have a very, very localized, perhaps even an indolent cancer, and you may not even require treatment. We can wait and watch on this cancer. So there are many options for you. So I think your priority should be getting your second dose rather than worrying about the PSA value, which is just 7.
This is, I'm not sure if this comes into your purview, doctor, but let me read the question if you can answer. Otherwise, you can suggest the right way out. History of pulmonary embolism. Shweta is asking, currently on BAF 10 MD DVT, is it safe to get the vaccination done?
All right, so there has been a few events across the world, especially with the AstraZeneca's Covishield, where there has been instances of clot formation. And therefore, certain countries even took this drastic step of holding on to that vaccination schedule. And of course, now they have cleared it up and restarted that. So there is a certain degree of interaction between the coagulation system, the blood clotting system in the body, and the vaccines, and in certain small fraction, it is about 0.003 or something, where they tend to get clots. Now, if you're already on the having the clot, and if you're already on the treatment for that clot, I think you just have to do your what is known as an INR ratio, and when it is in the safe limit, go and have the vaccination. There is no problem. You're already protected for that clot, so you have no problem at all.
Lalita's question, can we stop taking the anti-cancer drugs like geftinib or osimertinib while we observe COVID symptoms and take antibiotics for the cure of COVID infection? Or do we also take anti-cancer drugs with antibiotics?
You must take both together. And I would strongly suggest your cancer medicine is more important than the COVID medicine, because COVID medicines are all indirect in action. So they may help, they may not help, but cancer medicine is direct in its action. And if you are taking geftinib or osimertinib, I would assume that you're having lung cancer. And lung cancer's treatment cannot be delayed. It should not be stopped, interrupted. So I would suggest that it is a big boon that we have this medicine, because this used to be considered such a very fatal cancer about 15, 20 years ago. Thanks to all this genetic research and molecular targets that we identified, this drug is become the wonder blockbuster drug for lung cancer, that we are even seeing people alive after 5 years and 10 years post this treatment. So therefore, please make sure that you don't discontinue on that lung cancer medicine.
Yes, there are a few fans of yours, Dr. Manoj Kumar PV and Meenakshi Narayan, who have sent you hello and thanking you for the healthcare in the tough time for your thanks to your services. Good to watch this. Thank you, Doctor. Yeah.
Thank you very much.
Yes. Any pre-tests to know that the cancer is developing, or how to identify cancers? This is a question from Mr. Ramanjane, who is a doctor.
Yeah. Okay. So we tend to kind of use the screening program for identifying cancers which are not manifest. So if you are still not having any symptom also, at the right age, and we have specific guidelines in terms of the gender and the age group at which you need to go and have your screening test done. For example, in the women, if they are past 40, we would advise them to go and have their breast mammography and pap smear for their cervical cancers. And like that in the men, because our registry shows that we have a higher incidence of stomach cancer, both in Andhra and Chennai particularly, at 40s, we would rather go have a endoscopic examination done. For a colon cancer, we tend to do a stool examination to check out for any microscopic blood traces. And there is the blood test, which will show whether if your PSA is the right value or not. So screening tests, which are available and which must be used at a community level, is strongly recommended. And any kind of symptom, whatever that symptom may be, that may be subtle and that may not be disabling for you, but if it persists for more than 2 weeks, it is an indication that we should go check and investigate, and don't take any hypothetical diagnosis and don't take any across-counter drugs. That is the biggest mistake, which allows us to see the cancer grow right in front of our eyes. So that is not something we should do. We must always go get investigated. So we should keep 2 weeks as the cutoff time for any subtle symptoms. And if it persists, please go get investigated.
Okay. Ascent Consulting, naam nahi hai, but can CLL patients under wait and watch take the vaccine for COVID?
Of course they can, yes.
Yes, so there are no different from the other candidates, right? So Shweta is asking, lung nodules, no change in the size since 2 years. Doctor told me to do CT scan for every 2 years to know if it is proceeding towards cancer or not. Please advise me, what do I do? My age is 55 years.
All right, so if you have a lung nodule which is stable for 2 years, we probably consider that as non-cancerous, or if worse, a low-grade cancer. It is not growing fast. So 2 years is a long time for any aggressive cancer to show up in terms of increasing in size and multiplying itself many times over. So therefore, the fact that it is stable for 2 years is either it indicates benign or low-grade cancer. So I would I'm sure they would have done a PET scan for you to look at the metabolic activity of that nodule as well, and then therefore asked you to keep it under observation. But at any point in time, the answer would be to go and have a biopsy or get that lump out, so that you're ridden of the system and that is clarified as to what it is ultimately, rather than guessing on this.
Exactly. Thank you, doctor. Next question is Mr. Manoj Kumar. My wife got esophagus surgery due to food pipe cancer in 2018 June. Since then, there's no cancer. Due to the pandemic, should we could not go for the April 21 consultation. She is good right now. Should we delay visiting the hospital? This is a fear, doctor, and this is a real fear of getting out.
So I should, for the people and others in this program, emphasize that there is a study from Andhra and in Tamil Nadu that has been published in the very famous Science magazine, which showed the transmission rate of COVID is far less inside the hospital than at your home as well. So if the transmission rate in the hospital is around 1.5%, at home rate is about 5 to 6%. And in a community or in a closed hall, it is about 10 to 15%. That is the transmissibility rate. So first of all, to think that hospital is an unsafe zone is a mistaken notion. The second thing is you have had esophageal surgery done 2 years ago, and therefore you're off treatment for a substantial period of time. And now is safe enough to go and have your vaccination and not fear about the exposure inside the hospital. And again, like I told you, we have to take all the protection like any other member of the public. You go into the vaccination center with your mask up and then get it done and come back.
Okay, that's it. Datta Ray is asking this question, who's a cancer patient since 2005, is presently under fulvestrant and abemaciclib. Can they take the vaccine, or do the medications need to stop?
So the fulvestrant is hormonal treatment. It doesn't interact with your immune system, so you're quite safe to go and have your vaccine as well. No need to interfere or interrupt the treatment.
Okay, done. Thank you, doctor. Mr. DJ Datta's question, I think that is asked, sorry. Tabrez Khanji ka question. If my platelets are down after COVID vaccine taken, is this an issue to be concerned?
It depends on how much the platelets has dropped and whether if it has anything to do with the vaccine at all. So we've not had many reports to say that vaccination causes a drop in your platelet count. So you must go and have a consultation specifically about why the platelet counts are low if you are having an issue with it. But there is no direct association between vaccination and drop of platelet counts.
Okay. Mr. Ganesh Ramaswamy is asking this question. I'm not sure if he can answer this here or he can consult on the platform as well, but I will put the question at your disposal. I have been detected for PV. I'm not sure what that is, doctor. Past 2 years, I'm taking hydroxyurea 500 1 cap. How long do I have to continue? Will this drug work for 70-year-old? I am a non-smoker.
All right, so I think you should consult your oncologist on this. They will monitor your disease status now and advise you accordingly. So it is more individual call that you should take with your oncologist.
All right. Anuradha Cutica questionnaire. I am malignant melanoma patient since 2015 and I have completed surgery and no radiation chemo is done. Can I take the vaccine?
Absolutely. You are cured of your illness and therefore you're no longer trying, shouldn't identify yourself as a cancer patient. You're a normal person. Go ahead and have your jab.
Right. Can you, Khadija Begum is asking, surgery is approaching in about 3 weeks. Can I take the vaccine now? With surgery, you mentioned nahi kiya hai, but surgery.
Okay, so you can have your first dose at least. If you have 3 weeks interval, you can have your first dose of your vaccine. Go for the surgery, and once you recover and convalesce from your surgery post-op thing, then you can go for your second dose.
Done. Mr. Sabir Ali says, people who have lipoma lumps nearly 10 to 15 in the body, can they take the vaccine without fear?
Absolutely. I mean, lipomas at 10 or 15 or even 100, there is no problem. Just go ahead and get your vaccination. Lipoma is just a fat blob sitting under the skin. It's not going to do you any harm.
Okay. Okay. So here's an interesting question, doctor. Mr. Hem Kumar Prasad is asking, what is the best way to help one quit smoking?
Oh, well, there is several ways. I don't know whether if he's asking for himself or if he's asking for his friends or family members, it doesn't matter. The quit smoking is a very, very standardized thing. The first thing comes from the individual motivation. And if you're motivated and you can quit at one go and maintain that, it is good. We had one member earlier in the show who has demonstrated for the last 4 years that he can quit and stay away from smoking. But in spite of it, we have other assisting methods as well. So there are methods called the psychological approaches and pharmacological approaches. So we can have specialized counseling given for people. It is basically smoking is nothing but an addiction. And the addiction is nothing but there is certain changes in the circuits of your brain which associates nicotine with any other activity of your body. So some people think if they don't smoke, they cannot concentrate, they cannot be creative. If they don't smoke, they cannot go to the toilet. If they don't smoke, they cannot do this, that. So all this kind of associations get falsely built inside their brain, which can be easily dissociated with some level of cognitive behavioral therapy. So that is not an issue. And beyond that, we have a lot of adjuncts to quit smoking, because your addiction is only to one component of 4,000 damaging chemicals inside the cigarette. So it is only about nicotine. So if we can kind of replace the nicotine by many methods, there are short acting, there are long acting methods of nicotine replacement. Like if you have your gum or some form of chewing thing, it is a short acting one. But if you have a patch, it is a long acting kind of nicotine replacement. One or the other or a combination of this can actually get you out of this physical dependence. What happens is you get very scared and stressed as soon as you quit smoking. You start, your heart rate goes up, you start sweating, you become restless, irritable, sometimes delirious with the withdrawal, and therefore you tend to go back to get a smoke, and that assuages all that kind of a feeling. So once you replace that with nicotine, then you are able to physically withstand that quitting of the smoking, and gradually we can withdraw from nicotine also. Now, so recently there has been a trend towards e-cigarettes and vaping, which I think is equally damaging to the lung, and especially with kids, it has caused a tremendous amount of lung injury. So therefore, I do not want anyone to think that electronic cigarettes are any safe replacement to the tobacco usage as earlier. See, this is a constant misinformation ingeniously propagated by tobacco companies. Tobacco companies were the father of all fake information. They 50, 60 years ago had to create a research lab and produce all kind of fudged data in order to convince even the doctors by publishing their fake articles in reputed journals, and delayed the anti-smoking campaign a whole number of decades. And finally, the master settlement came in America around 1995. So you can understand about 40, 50 years they've been dodging about this. And they're coming back again with various other types of ingenious methods to addict you once again. So therefore, there is no safe replacement for tobacco one way or the other.
Okay. So quick additional question to the same topic, doctor. Somebody's been trying to quit smoking, but is not able to continue it for a long time, and then after a brief time they're coming back to smoking. How can we help such people?
Well, we need to seek professional help, and first thing, hats off to you that you're making an attempt. So in a clinical setup, for example, many of our Apollo doctors who are having this expertise would tell you, they first have to ask you whether if you're a smoker and how much of smoking that you do. And then you tend to advise them, do they mind quitting the smoking, and if they're willing to quit smoking, and then we tend to assess kind of how we can do that, assist you how to quit the smoking, and also, follow it up with arranging follow-up visits to see that you don't relapse. So this can be done. All this serial things about quitting smoking can be done in a very professional way in any of the Apollo hospital centers by any of the experts. And you need to reach out for help, because if you have tried sufficiently number of times and you have relapsed from that quitting attempt, you become a very deserving candidate to go for professional help. And I would say smoking is a disease. So you need to treat the smoking before it causes yet another disease like cancer to go for a treatment. So now is the time to go for getting this addiction problem sorted out.
Wonderful, doctor. So no better day than tomorrow, which is the World No Tobacco Day, 31st, and fix an appointment, go right away and get it. Two questions quickly. I want a very quick answer before I read. One is, Aruna Manna. I've survived oral cancer 5 years back, and I have concerns on the much hyped black fungus and also the white fungus. Are we at risk?
The oral cancer patients, or for that matter, any cancer patient who is not on treatment is not at risk at all. Now, those cancer patients who are at risk could be ones who have very aggressive chemotherapy, like by way of having to do bone marrow transplantation or intensive treatments like that, like in terms of leukemias, which are acute leukemias particularly, not about the chronic ones. So these sort of patients tend to have their bone marrow completely blown off nearly, and so they are like very, very vulnerable. And therefore, any kind of organisms on their own skin, on their own nasal passages, oral cavities, can become pathogenic. In normal course of events, in normal people, it will not bother the individual at all. But in an immunocompromised, in a vulnerable person, that commensal, we call it, can itself become pathogenic and then invade the tissues and develop into an infection. So if Aruna is 5 years treated and treatment free for the last 5 years from oral cancer, there is no fear whatsoever about black or white or any type of fungus, you can call it.
Very positive. Thank you, Doctor. And with that question, I will wrap up. There are a few questions where Doctor can be consulted on Apollo 24/7 platform online. And before we take leave from you, Doctor, I would want you to give us top tips to take care of cancer during the COVID times.
Well, one has to remember that cancer is not a fearful disease. One has to understand that after treatment of cancer, you're as good as normal and you're not at extra risk for contracting COVID. And you would want to quit any kind of tobacco habits in this trying times because of lockdowns and because of isolation and because of social distancing. Three things happen is one, we become very anxious and we become depressed, or we tend to go on to use some of the substances like smoking and other things to get over with this problem. So I would suggest that not fear about all this. This is a passing phase and everybody can go have your vaccination and your treatment if required. And if there is no treatment for your cancer, be safe and be happy.
Wonderful. Thank you so much, Doctor. It was a great pleasure having you on the show, and you have a great amount of patience of answering these questions. Thank you once again for joining us today. Thank you. So that's it, folks. Wonderful. Please do take care of yourselves and quit smoking. That's a great call from Dr. C.S. Mani. And I leave this session of your questions, and I start on with my questions. This is the health quiz coming up. I'm going to ask you 3 questions. Please do type your answers in the chat box. Winner's name will be announced towards the end of the show. And winners, if you're declared one, please do write back to us with your contact details on marketing@apollo247.com. The gift vouchers will be shared with you. So get ready. Here's the question number 1 coming up. What is the cancer of blood cells called? A simple question. What is the cancer of blood cells called? Question number 1 was that. And coming up is question number 2. When is the World No Tobacco Day? मैंने आज शो पे 3-4 बार बोला है. अगर आपने सुना है सही तो आंसर आपको पता होगा. Go ahead and type. When is the World No Tobacco Day? Very simple. It's coming up. And question number 3. Which option of Apollo 24/7 app enables you to scan and upload your past health records? I repeat my question. Third question, which option of Apollo 24/7 app enables you to scan and upload your past health records? अगर आपको आंसर पता नहीं है, go on, अपना ऐप खोल दीजिए, देखिए कौन सा टैब है वो और टाइप कीजिए. Let me see if the answers are coming in. Yeah, lot of answers. 31st May, 31st May, 31st May. बहुत सारे लोगों ने आंसर किया है, but I will wait for the winners to come up, the names to come up. In the meanwhile, let's talk about post-COVID care, which has become very important because large number of people are recovering from COVID in the country. But after COVID recovery, also you will need expert tips about diet and lifestyle, chronic conditions, mental health, and more, with videos, consultation dedicated to post-COVID care. Apollo 24/7 has made this possible. So if you want to reclaim your health after COVID, here's a special page designed for you. Website में एक special page है, आप जाइए. You can please go ahead and scan the link which is given, the barcode which is given on the screen. You will see a lot of details there dedicated for the post-COVID. So let us now see who the winners are. The winners are Priya Krishnaswamy, Ramesh Tarala, SS Jewelers Mylapore. Congratulations. Please do write back to us at marketing@apollo247.com and claim your gift vouchers. Thank you all for joining, because your question is answer for many. And thanks for asking these questions here in the live session. As a small token of gratitude, here are the gift coupons which you can use on Apollo 24/7 app. Use the coupon HH247 to get up to $199 off on online consultation with Apollo doctors. Use the coupon HH247 to get 15% off on medicine orders. So that's it for today, folks. Thank you so much. We appreciate your feedback. Do take a minute to write back on marketing@apollo247.com. Thank you. We'll join you next week.